In this session, we're going to hear how non-government organizations and government agencies worldwide are working closely to incorporate patient insights into their deliberations and policies. Our next guest is Jack Fisher, who joins us from Switzerland, where he works for the World Health Organization. Jack is a technical expert on the development of a platform for the World Health Organization that's designed to incorporate patient voice throughout the world and to take the lived experiences in patients and bring them into the deliberations of the World Health Organization. Why is this important? It's important because patients throughout the world have disproportionate voice in the affairs in their countries. And in terms of kidney disease, making certain that an international body like the WHO hears directly from patients is vitally important. And it's a key issue for the American Association of Kidney Patients, which is working to organize patients worldwide. Jack has been an absolute champion of patient engagement and advocacy, and he will detail now some of the work of the WHO that we've been able to be a part of for over the past year. Jack, go right ahead.
Hello there, my name is Jack Fisher. I'm a technical officer here with the WHO Global Coordination Mechanism on NCDs based in Geneva, Switzerland. And it's a real pleasure today to be able to speak to you as part of the 4th Annual Global Summit on Kidney Disease Innovations. Today, I'd like to spend the next 10 to 15 minutes talking about WHO's efforts around meaningful engagement of people living with NCDs and mental health conditions, and the process and the eventual launch of a WHO framework to support that aim. So before we jump into some of the specific work that I'm involved in as part of the Global Coordination Mechanism on NCDs, I want to take a step back and refer to what we are talking about when we refer to non-communicable diseases and mental health conditions. As you can see here in the diagram, the so-called 5x5 model, which was updated as part of the 3rd UN high-level meeting on NCDs in 2018, refers to the so-called Big Four as part of the NCD acronym: cardiovascular diseases, chronic respiratory diseases, cancer, diabetes, and their associated risk factors, as you can see at the bottom of that diagram. But I very much want to acknowledge that as part of this work, we also include other chronic conditions and other lived experiences, which includes individuals living with kidney disease. And a big focus of this work around the framework is really trying to promote the idea of an intersectional approach, both when it comes to tackling NCDs and mental health conditions, but also integrating the lived experience as a form of expertise as part of this evolving and very exciting work within WHO. Now, to look at the GCM's engagement on this topic, we actually have to go back to 2016, where our interest started with individual activities and engaging individuals with lived experience as part of those individual activities. And that included a short film series, included campaigns, and that then evolved to including individuals with lived experience as part of different global dialogues and different UN high-level meetings. And then, of course, in 2020, we saw through the COVID-19 pandemic that individuals living with NCDs and mental health conditions were disproportionately affected by the COVID-19 pandemic, both in terms of their increased chances of hospitalization and mortality, but also, again, highlighting the importance of engaging those individuals as part of the so-called Build Back Better response to COVID. So for us, it was a very important moment to stop and reflect, both in terms of the changing global landscape within NCDs and mental health conditions, but also really to reevaluate our position as WHO within our role to support individuals with lived experience, but also to support WHO member states in doing the same. As you would have seen in that previous timeline, one of the activities that we conducted at the end of 2020 was a global informal consultation with people living with NCDs. And this is really important for us to listen and learn from those individuals with lived experience and best identify how WHO can support those individuals going forward post-pandemic. And whilst this was a very traditional informal consultation, it also included many untraditional approaches, which included participatory approaches where individuals with lived experience were leading the informal consultation. And we really tried to maximize participation of individuals with lived experience as part of that 3-day consultation. The outputs and the results of the consultation can be found in the Nothing for Us Without Us report, which you can find online. But on the screen right now include a number of the next steps which were outlined as part of that consultation. And I won't go through all 7 of the next steps right now, but the most important really was the commitment from WHO to co-create an action plan, which we now refer to as the framework, with people living with NCDs and mental health conditions to support WHO and their respective member states in adopting meaningful engagement. And I'm pleased to say that the other steps you can see here have or will be addressed as part of the co-development process of this framework. What exactly is this framework? Well, this framework will be a WHO framework that will guide WHO and WHO member states in the meaningful engagement of people living with non-communicable diseases and mental health conditions. Now, of course, there's a broad range of applications for this global technical product from WHO, but ultimately it will support individuals with lived experience, co-developing and co-implementing related policies, programs and services, and ultimately the things that matter most to them. As part of the co-development process of this framework, we really wanted to incorporate a bottom-up approach where individuals with lived experience were engaged as part of every step of the framework development process, but also we're really driving the evidence generation, driving the direction of the framework, and really ensuring that their perspectives and expertise were really leading this process. So as part of the co-development process, we've also established 4 pillars. The first is around building evidence. This is really particularly important as an evidence-based organization. We acknowledge that there is very limited peer-reviewed evidence on this area. Now, please let me clarify that this only applies to the area of NCDs and mental health conditions. It doesn't apply to the topic of meaningful engagement when it comes to other health topics such as HIV and AIDS, TB, maternal and child health, etc. So as part of this novel area as it applies to NCDs and mental health conditions, we really wanted to leverage our role to build that evidence. And of course, as it is a novel area, we're also identifying gaps. So as part of the framework, we want to identify those gaps and also highlight ways that collectively we can fill those gaps going forward. The third pillar is around building networks. This is very important as part of that co-development process. Again, featuring individuals with lived experience, featuring our partners, whether it be from civil society, and also other UN agencies as well. But it's not just about the co-development process. Those same networks will be incredibly important when it comes to the implementation of the framework in 2023 and beyond. And the fourth pillar is really, really important. It's around establishing trust. Trust with those individuals with lived experience in their respective communities, but also given their sensitivities and the commitments that individuals with lived experience are providing their expertise, their insights to WHO as part of this process. However, as part of this co-development process, we're also asking ourselves the difficult questions, ourselves as WHO, as an organization which holds power. So how do we create a more equal playing field within WHO's environment? And how can we readdress and rebalance these scales, acknowledging currently there is a weight towards our member states, our scientists, overemphasis towards the importance of the UN models, including biomedical models, and the requirements for quantitative data. And as many of you may know, WHO is also ingrained within different processes and procedures, which can make it difficult, especially when we consider the respective changes that are required when it comes to operationalizing meaningful engagement of individuals with lived experience. So how can we balance the scale where individuals with lived experience are more engaged as part of WHO's work on a continual basis? How can civil society organizations continue to support WHO's work? And how can we include more marginalized groups and more hidden voices as part of this work stream as well? And again, referring back to some of those overemphasis and requirements around biomedical models and quantitative data, how can we balance that by including lived experience as a form of expertise and information alongside those more traditional forms of data? And how can we include independent voices as part of this work stream as well? Very much acknowledging many people who have engaged as part of this work stream, and many people in the room right now wear multiple hats. So how can we include more independent voices going forward? As mentioned, to incorporate a range of perspectives, experiences, and expertise as part of the co-development process for this framework, we had to establish a range of evidence-based generation activities as part of the process to develop the framework. This included a literature review, which again included a number of key informant interviews with individuals with experience. We also conducted a range of participatory research activities, which included, again, focus groups with individuals with lived experience and a range of case studies, which will be released later this year. We have hosted a range of global and regional consultations. Again, those regional consultations included consultations across the 6 WHO regions. And we've also engaged in a number of different advocacy activities, again, many which will be released later this year and next month, more specifically, a short film series and an animation describing the concept of meaningful engagement and the concept of lived experience as well. So to the right of this diagram, you can see that the networks have been incredibly important to feed in to those different evidence generation activities, but also are crucially important when it comes to supporting the outputs. And again, I'll touch upon that a little bit later in this presentation. However, given the nature of this work stream, and we acknowledge that we will continue to add and evolve this evidence base as we go forward. This will continue after the framework is launched in 2023, and we've already tried to include provisions when it comes to this iterative thinking approach when it comes to the co-development process. So we're constantly trying to listen and learn as part of each activity, collect and ideate with individuals' lived experience, and then we have a period of analysing, reviewing that evidence, and then we consolidate and strategize, and then repeat that process across different activities. And it's been an interesting process to try to meaningfully engage as part of this co-development process, whilst also trying to establish what does that actually mean for WHO. So I'm pleased to say that each activity has included a range of different co-design processes with individuals lived experience as part of each activity. And that also includes a co-production of each output. So that's really important for us to ensure that we are trying to be as meaningful when it comes to this co-development process, to ensure that the evidence base that we are using now to develop the framework was as true to the concept of meaningful engagement as possible. But as mentioned, this will continue as we finalize the framework co-development process and for its launch, but also for the different derivative products which will be launched and developed next year, which will very much support the implementation with, again, individual lived experience. So there's lots of opportunities where you will be able to support this process going forward. It's very important for us to look at the ways that we can integrate this framework into those other mechanisms and other frameworks which currently exist. And this is really important when we again come back to that concept of intersectionality, and also acknowledging that we need to take an integrative approach when it comes to operationalizing meaningful engagement, and also trying to break down some of those silos and barriers that I previously mentioned. So we've been actively looking at integrating this framework into the wider UHC activities, looking at our mental health colleagues who are very advanced in some areas of their work, in particular around the quality rights approach for mental health. Our colleagues in the UN Decade on Healthy Aging have also launched a decade-long work stream, which again we're working with those colleagues to integrate this work as part of their meaningful engagement efforts. And of course, there's other roadmaps from WHO and other agendas such as the disability inclusion in the health sector as well. So those are some of the internal areas of alignment that we're exploring, but there's also many external. And again, you can see some of those listed there as part of the UN AIDS, GIPA, and New Global Strategy, which goes to 2025, other civil society frameworks and charters. But also we're very open to exploring further external areas of alignment and collaboration, whether they be from member state-led mechanisms and frameworks, and also other kidney-related mechanisms and frameworks, So very much welcome you to share those as part of the summit today, and I look forward to hearing those. However, before I leave you today, I wanted to share some of those key takeaways that we as WHO have learned as part of the framework co-development process to date. And we hope very much that some of these takeaways will be included as part of the framework to be released next year. So first is that meaningful engagement can reorient power to agents of change. It's very important to create enabling and protective environments, allowing lived experiences to thrive. And that really diverse perspectives and equitable representation for marginalized populations can really enhance those engagements. And of course, optimizing diversity and inclusion through different outreach and engagement activities can lead to new voices in new places being engaged as part of those activities. But really, we need to establish really sustained networks and strategies and frameworks to support that aim. In addition, it's really important to move from just intention to action. We need to move from just talking about the importance of meaningful engaging to actually operationalizing meaningful engagement. And that can really only be achieved where we transfer power to individual lived experience. And of course, that can be challenging historically, where we need to acknowledge and address systemic power imbalances, which include social inequalities, racism, and decolonizing global health. And finally, we also need to ensure that we have sustainable funding to establish models and mechanisms and fill the gaps when it comes to evidence and representation, and ultimately to sustain action. And again, that final one around financing and really ultimately paying individual lived experience for their time and their expertise is something that we hear across a range of different activities. So finally, how can you support going forward? Well, as I mentioned, this framework is for WHO and WHO member states to implement, but you as our partners, and particularly those from the kidney disease community, are really crucial to supporting the co-development process of this framework, but also really crucially important to supporting the implementation of this framework from next year onwards. And again, that can be from a global level, a regional level, and a country level. So we very much welcome you to share your lived experience and expertise with WHO and WHO member states. And again, there's a range of different activities, both through our work as the global coordination mechanism, but also other technical areas within WHO, both in terms of headquarters and regional offices. In October, we hope to be launching the online consultation on the zero draft of the WHO framework on meaningful engagement of people living with NCDs and mental health conditions, and very much welcome you to provide your feedback and inputs in terms of that zero draft before it's finalized later this year. As mentioned, we will hope to launch this framework in April of 2023. So very much welcome you to support that launch with more activities, so more information to be released on that shortly, including the different derivative products which will be supporting implementation. And again, very much welcome ideas on those different activities, different derivative products, opportunities for alignment, and opportunities to implement this framework as we go forward. And the last, maybe provocative message I want to share is to also hold those in power accountable. And I include WHO and WHO member states in that as well. So I hope that outlines how you can support. I hope this information session on the WHO framework in terms of what's coming, but also the co-development process and how we are trying to meaningfully engage, both in terms of this activity over the last 18 months, but also our commitment as an organization going forward across the 3 levels of the organization and across our 194 member states as well. I very much thank you for your time and listening today. And I've shared my contact details again at the bottom of the screen. And again, very much welcome additional inputs, suggestions, and feedback. And thank you for listening.
Thank you so much, Jack. And it's a pleasure to see you from Switzerland. We look forward to more collaborations with you throughout the coming year. I'd like to also thank again Dr. Van Holder. Through the European Kidney Health Alliance and the World Health Organization, AAKP is expanding our reach and collaborations with patients worldwide, and the non-government organizations and international government organizations that work most closely with patients and whose deliberations have an absolute impact on public policy and the lives of patients. Thank you both.